Today we are diving into those absolutely critical moments where a few seconds can mean the difference between life and death. We're going to break down life-threatening injuries, what they are, how the pros respond, and what it really truly takes to survive. Let's get right into it.
I want to start with just one number, 4.4 million. Now, it's a huge, staggering figure, right? But what does it actually represent? Well, it's the whole reason we're even talking about this today. That's how many people die from traumatic injuries, every single year all across the globe. Think about that. It's like a silent epidemic that touches every single country, every community.
And here's the part that's really sobering. For anyone between the ages of 1 and 44, trauma isn't just a cause of death. It is the #1 cause. We're talking car crashes, falls, you name it. This isn't some distant threat. It's the single biggest danger to people in the prime of their lives.
So what exactly makes an injury life-threatening? It's not just about how bad it looks on the outside. It's about what's happening deep inside the body when every single second counts.
Basically, a life-threatening injury is any kind of physical trauma where, if you don't get medical help right away, the likely outcome is death or a permanent disability. The key words there: immediate medical intervention. Time is the real enemy here.
All right, so let's get a much clearer picture of what these dangers actually look like. We're going to break down some of the most critical injuries, the ones that first responders are trained to spot immediately.
You know, major trauma isn't something that's just confined to one part of the body. The danger can come from anywhere. We're talking devastating head injuries, spinal injuries, massive internal bleeding, or severe burns. Each one of these presents its own unique and very immediate threat to life. So let's zoom in on one of the most complex injuries out there, the traumatic brain injury, or TBI. Often, it's not the initial hit that's the real killer. It's what happens after, the swelling inside the tight space of the skull that starts cutting off blood and oxygen. To figure out how bad it is, medics use something called the Glasgow Coma Scale, or GCS. It's a really fast way to score the injury and decide just how aggressive the treatment needs to be.
And this right here, this highlights what makes brain injuries so absolutely terrifying. A patient can actually seem okay. They might be talking and totally alert. It's called a lucid interval. But on the inside, a bleed could be getting worse, leading to a sudden, catastrophic collapse. This talk and die scenario is a classic and deeply feared warning in emergency medicine.
Okay, now for the silent killer, internal bleeding, which leads to something called hemorrhagic shock. There are 4 classes of shock. In the beginning, the symptoms might be pretty subtle, but by the time you hit class 3 or 4, the patient has lost over 30% of their blood. Their organs are being starved of oxygen, their body is shutting down, and they are literally minutes from death without a massive, coordinated response.
And you just can't talk about major trauma without looking at the chest. Injuries here are incredibly lethal. Take aortic disruption. That's a tear in the body's main artery. A staggering 80% of victims die before they even get to the hospital. And with things like a tension pneumothorax or a cardiac tamponade, you've got air or blood literally crushing the heart from the outside.
So, faced with this kind of absolute chaos, how do emergency professionals actually save lives? Well, they don't guess. They use a proven, methodical system that's designed to bring order to that chaos.
It's called the ABCDE Primary Survey, and it is the absolute bedrock of trauma care. The logic is so simple, but it's incredibly powerful. Think about it. You can't breathe if your airway is blocked. Your heart is useless if you're not breathing, and you can't worry about a broken arm if you're bleeding to death. This system forces responders to fix the biggest threat first, then the next, making sure nothing critical gets missed. It is a simple, elegant system that saves countless lives.
So we have the right system, but there's one more factor that trumps everything else. It's a concept that completely revolutionized emergency medicine, and it all boils down to a desperate race against time.
60. What does this number mean to you? 60 seconds? 60 days? Well, in the world of trauma, this number is everything.
It stands for 60 minutes. From the moment an injury happens, a patient has about 1 hour, what we call the golden hour, to get from the scene to an operating table.
And that clock, it is absolutely ruthless. Responders are aiming for just 10 minutes on scene, 10 minutes for transport. That leaves only 40 minutes for the hospital team to stabilize and get that patient into surgery. After that 60-minute mark, the risk of death just skyrockets. This is why you see medical helicopters, why ambulances race through traffic. They are all fighting this clock.
So, as we wrap this up, let's bring it all together. What is the ultimate key to surviving a life-threatening injury? The truth is, it's not one single thing. It's a chain.
At the end of the day, survival depends on every single link in this chain holding strong. It starts with a bystander who recognizes the danger, it continues with first responders who control the immediate threats, and it ends with the trauma surgeons in the hospital. If any one of those links breaks, if time is wasted, if a step is missed, the outcome can be tragic. It's all connected.
And I want to leave you with this quote from Dr. R. Adams Cowley, the military surgeon who pioneered the whole golden hour concept. He called it the golden hour of opportunity. See, it's not just a window of time, it's a window of hope. It's a chance to turn what should be a fatal injury into a survivable one. It's a powerful reminder of just how fragile life is and how critical every single second can be.